Hi, this video is a Q&A for you all about my surgery and lipedema journey. If you are new here, my name is Leah and I have lost over 200 pounds naturally. I also have a condition called lipedema, and so that's what I'm going to be sharing about. And since I have lost over 200 pounds, I have gone through 3 loose skin removal surgeries so far, and I'm going to be answering your questions all about it. How did you discover you had lipedema? So if you are unfamiliar with lipedema, lipedema is a hormonal condition that causes fat to grow disproportionately. It often mostly accumulates in the hips and thighs, but it can be anywhere in your body, and it can cause your fat can become fibrotic and become scar tissue, which makes that fat harder to lose through diet and exercise. Some professionals would say you can't lose it through diet and exercise. Some might say that it's just harder, but it becomes scar tissue, and so it often you need to have surgery to break it up, to remove it. There are other conservative methods that you can do to treat it as well. How did I discover that I had lipedema? I started sharing online about my weight loss and my health journey, and pretty quickly I started receiving comments that said, "You have lipedema," or "It looks like you have lipedema," or "You should look into lipedema." Most just diagnosed me. They just said, "You have lipedema." And I was like, I don't know what that is. I looked it up. I saw what it was. I learned about what it was, and would just comment back to people and say, "No, I don't have lipedema. Like, I'm just Italian. I just have big hips. That's just my body shape." And I just shrugged it off. As I continued sharing online for about a year, I continued to get those comments. I was curious about it. I looked into symptoms. I didn't really have any of the symptoms. It mostly affects females, and most of them are in daily pain with their lipedema. And thankfully, I did not and do not experience that. If anything, I experienced like a little heaviness in my legs. I do bruise easily. And then what really made me feel like I wanted to be officially diagnosed was I felt my thighs and could feel hard nodules under my skin, but I had never felt anyone else's thighs, so I didn't know that was unique to me. I started asking my friends if I could feel their thighs, and I was like, oh wait, you don't have this. And it wasn't just a matter of because I had extra weight on me. I felt the thighs of someone who was even bigger than me at the time, and she did not have the hard nodules. So I decided I'm gonna look into this, and I scheduled an appointment with Dr. Karen Herbst, who is in Tucson, which is just 2 hours from me. I'm in the Phoenix area in Arizona. I went to see her, and she did officially diagnose me with at least stage 3 lipedema. I had a lot of loose skin at the time when I went for my diagnosis, and so it was hard to tell, but she did say I had stage 3 lipedema and that it was throughout my whole body, but primarily in my hips and legs. So that is how I found out that I have lipedema. How did you find your doctors and decide on surgery? So I chose Dr. Karen Herbst because she is one of the top specialists in the country, but she also is only 2 hours from me, so that was easy. And when I went to see her, she works with the Advanced Lipedema Treatment Program at the Roxbury Institute, which is the surgery center that I decided to move forward with for my surgeries. I enjoyed meeting with her, and so then after she recommended me to them, I had a consultation with the surgeons there who would be working with me. And something that I really liked about this program was that they had a plastic surgeon. They have a plastic surgeon for the skin removal that I wanted, as well as lipedema specialists for the lipedema portion of my surgery. So I loved that I could get all of those things done at one surgery center. How did you know when you were ready for surgery? I'm not sure if this question is specifically about my loose skin surgery or my lipedema surgery, so I'll answer both. As far as lipedema surgery, as I mentioned, I didn't really struggle with the symptoms that a lot of people do struggle with. However, I knew I wanted to get my loose skin removed, and so I figured I might as well treat my lipedema at the same time. I'm very thankful that I wasn't living in daily chronic pain because of my lipedema, and I also didn't want to live in that pain later in the future. So I thought it would be better to treat it earlier on, which basically just like sets it back to the earliest stage possible so that you can continue with conservative treatments like lymphatic massages and compression to keep it at bay as much as possible, and then hopefully not be living a life where you are in pain. As far as how did I know when it was time to have my loose skin removal surgery, I just got to the point where I felt like I'm at a weight that I feel comfortable with. It wasn't a goal weight that I reached. I got to a place where I was like, I feel happy and healthy. I feel like I'm able to do all the things that I want to do. And now this loose skin feels like it's the only thing potentially holding me back or inconveniencing me in some ways. And so that's when I decided that I was ready to have it removed. Which surgery was the hardest physically or emotionally? So I have had 4 surgeries this year so far. I had 4 surgeries in 6 months. My first surgery was a tummy tuck, a lower body lift, and pubic lift, and all of that was done in one surgery, 360 around my lower waist and back. That one was the hardest one, physically and emotionally. It was my first, so I tried to have realistic expectations going in. I learned as much as I could. I studied, I did research, but there are some things that you just don't know until you experience it. I was also told by my surgeons that that was going to be the most challenging one physically. And it was, and part of the reason for that was because of the drains. I had 4 drains attached to me. 4 of them were in for 2 weeks, and then 2 of them were in for 30 days. And it's just hard having these things attached to me, draining fluid from my body and just not feeling like myself. It was also a long recovery in terms of what I was physically able to do, what was uncomfortable to do, what was painful to do. So that first surgery I would say was my hardest physically and emotionally. My next surgery was a breast lift. I just got the loose skin removed on my breasts, and I did not get implants, or I didn't do a fat transfer at that time. It was just the loose skin removal. That one was one of the easiest, one of 2 of the easiest. Compared to the first one, it was really easy. I did have some nausea during that after that surgery. And that was just the worst part, which is pretty great that was the worst part. The recovery for that, I was already doing some things in my normal life again 3-4 days later. However, with my first surgery, I wasn't going out and doing things for at least a month. And then my third surgery was skin removal on my full arms, and that I have some kinesiology tape on it right now, which my lymphatic massage therapist put on for me to try out for a bit. So it's on my scars right now. For that surgery, I had skin removal on my full arms, and then I had lipedema removal in my calves and ankles. When I get the skin removals, my surgeon does also address the lipedema in those areas too. So it was addressed in my arms, and it was addressed in my torso if there was any there at the time. So that was my third surgery. That one was pretty challenging as well, not having the ability of my full arms. My hands got very swollen to where I couldn't even use my phone for a few days. And that one was hard mentally and emotionally too. And I just continue to remind myself, this is temporary. There was never a time that I regretted it, that I wished I hadn't done it, even though it was hard and challenging. I always knew that it was going to be worth it, and it absolutely has been. And then my fourth surgery was treating the lipedema in my thighs, and that one did not include skin removal. So that surgery probably was the easiest because it didn't include any invasive cutting. They just went in and broke up the scar tissue and removed the lipedema in that area. Would you still lose the weight if you couldn't afford skin removal? 100%, absolutely. No hesitation. I lived life for at least a year, close to a year and a half, around the same weight with a significant amount of loose skin, and my life was so much better without the weight, with the loose skin, than it was with all the extra weight. And that is not a visual thing. Visually, I didn't like my loose skin. It really is just a matter of what I was able to do, and I was able to be so much more free in my body. I was able to do more. I was able to move longer. I had more energy, more endurance. I was healthier even with the loose skin. The loose skin is irrelevant when it comes to your health. So absolutely, I would lose the weight every single time, even if I couldn't get the skin removed, because this isn't about aesthetics. This is about health. How much did your surgeries cost, and did insurance cover any part of it? Insurance has covered none of my surgeries. Occasionally, some people can get lipedema covered by insurance. However, at this point, it is still rare and it was not covered by mine. Insurance mostly sees skin removal as a cosmetic procedure, unfortunately, rather than a functional one. So it did not cover any of my skin removals either. I don't know the specific cost of each surgery right now. However, when it comes to all of them combined, I have invested over $120,000 on these surgeries so far. That is a lot of money. And I will also say that price does include a discount, collaborating with my surgery center to share about the experience, which I would not have done if I didn't feel confident in them and feel really excited to move forward with these surgeons in this surgery center specifically. Even with the discount, I personally have invested over $120,000 into these surgeries. And I don't regret it. How do I afford multiple surgeries is another one of the questions. I don't afford it. I am in debt from it. I am very grateful that I was able to get a loan from my parents for these surgeries. I have never been in debt before, which I really don't like being in. However, I knew that these were surgeries that I wanted to do. I knew that I'm a hard worker and I would be able to get to the point where I can pay it all off, and it was worth it to me. So I don't regret entering into debt to have these surgeries. I was worried about feeling the weight of that, of being in debt and feeling like that was so heavy. But I don't regret it at all. It was worth it to me, and however long it takes for me to pay it off, it will still be worth it to me. And I'm very grateful that I am in a position that I was able to get this loan from family so that I could have these surgeries. What advice would you give someone who can't afford these surgeries? Similar to what I said, like, would I do this again even if I couldn't have the surgeries? Absolutely. So the advice that I would give you is, as much as possible, focus on gaining health more than losing weight or being a certain body size or fitting a certain aesthetic. Focus on how you're feeling over how you're looking. Focus on living differently rather than just looking differently. I know it sounds like it's easy to say. I know that it's hard and it takes time to shift your mind around those thoughts, but it is possible. So if you can't afford the surgeries, don't let that keep you from getting healthy, please. Living in a healthier body with loose skin is so much better than living in a body that you feel burdened and limited by, and that you feel holds you back. You are going to be able to do so much more and live so much more life, even with the loose skin. So do it anyway. Get healthy anyway, if that's what you want to do, if that's what you're ready to do, and that's the path that you want to go on. How long did recovery take for each surgery? So each surgery is different. As I mentioned, the first surgery that I had, the tummy tuck, lower body lift, pubic lift, that was the longest recovery. It was at least 4 to 6 weeks before I was doing things out of the house. And keep in mind, this is going to be different for everyone. I've seen other people go through these surgeries and they're doing things within a couple weeks. I've seen someone else do it and they wanted months before they were back to work and doing things. So it is very individual to each person. I would say that it would be best to have, if you're doing something like that, a lower body lift, tummy tuck, you will want as close to 4 weeks as possible for that recovery. The recovery for my arms was also at least 6 weeks before I was able to reach in all the areas that I wanted to reach or put my arms back. have full mobility in my arms again. It took 6 weeks for that. I was able to do most things for myself within a few weeks from there. As far as the lipedema surgeries, I pretty much could get back to normal life-ish almost immediately. Within a few days, I could walk and just feel sore and tender. Obviously not doing as much activity as I would normally do, but I was able to live somewhat normally. I could go out with friends or could get back to work within a few days. The inconvenient part about that is that there is like some fluid leakage from those surgeries. So it's more inconvenient than anything, and I wouldn't say it's painful as much as it's uncomfortable for the lipedema surgeries. For the skin removal, it is painful. Definitely for the first few days, there's a significant amount of pain to where I almost ask myself, why am I doing this? And then I say, oh, I completely know why I'm doing this. And again, I have never regretted it, and I would do it all again. Like, I'm not even in a position where I'm like, oh, I never want to do that again. If for some reason I had to do it again to get the loose skin removed, I would do it again. It has 100% been worth it to me. How did you maintain your weight during recovery when you couldn't work out? So technically, did I maintain my weight? Yes. As in, the weight number on the scale is pretty much the same with normal monthly fluctuations that I've always had, as it was when I started my surgery. However, technically, that actually means that I have gained some weight because I've had about 10 pounds of loose skin removed. So I should be around 10 pounds less, but I'm the same. I do think that I gained some weight throughout this process. I'm being patient with myself because I also know swelling can play a role in your body, especially if you have an inflammation condition like lipedema, for 6 months to a year after surgery. So I'm being patient with myself. If I did gain 10 pounds, I'm not that worried about it. My priority was focusing on recovering and doing what I felt was best for my body and healing in the best way possible. And so I wasn't tracking calories, I wasn't being active every day, and that's okay. Like, my priority was healing. And if you are in a difficult season emotionally or a difficult season physically or mentally, and you gain a little bit of weight during that time to be able to continue to move through that season, I don't think that's the worst thing in the world, as long as you are mindful of it and you know the lifestyle that you want to be living and are living. There were certain things that I couldn't do while recovering when it came to movement, when it came to exercise, even when it came to preparing my own meals. There were times where I couldn't prepare my own meals, and so things were different, and I give myself grace and patience for that. So I mostly maintained my weight, but maybe didn't, and I'm okay with that. But the way that I did mostly maintain it is because I changed my life. I changed the way that I see food. I changed what food is for me. I changed the way that I view movement. So again, this was not a temporary diet just to reach a specific goal. I truly changed my lifestyle. And so that's how I'm able to at least somewhat maintain while going through this process. And so someone else also asked, like, how do you stay active during surgery, recovery, or breaks? So I didn't stay active in the same ways. I couldn't strength train for over 6 months. I couldn't do any ab workouts for 6 months. I couldn't play pickleball for a while. There were a lot of things that I couldn't do, but mentally, even though physically I couldn't do them, mentally, I didn't let my mind get to that place where I thought, these aren't a part of my life anymore. Mentally, I stayed in the same place, even if I couldn't physically follow through with the things that I wanted to do. And I think that made a big difference, so that when I was recovered enough, which is now, that I could get back to the things that were a part of my life before surgery and that I want to be a part of my life long term. So I am back into strength training regularly. I'm taking walks daily. And the reason that it is easy for me to start doing those things again is because now it's just who I am. My identity has shifted. I am someone who gets regular movement in. I'm someone who walks. I am someone who strength trains. That's who I am now. And so even with the breaks, I was able to start incorporating those things again. How do you deal with swelling and how do you manage your scars? So with swelling, there really isn't much that you can do aside from you wear compression to manage the swelling. That is the most important thing that you can do. However, it really just requires patience. You have to trust the process, focus on your healing and recovery, follow all the post-op guidelines and do everything you're supposed to do. As far as compression garments, I had someone ask also what compression garments I use. I use garments from a brand called Morena. I'm not sure if that's how you say it, but that's the brand of compression that I use. And I just stay patient. I remind myself that this is gonna take time, and it's gonna take time for the swelling to go down, and it's gonna take time to see my final results, and it's gonna take time to feel more and more comfortable in this body after these surgeries, and that's okay. And I can be patient. So that is something important. As far as the scars, I'm still learning how to manage them. As I mentioned, I have the kinesiology tape on right now. I've also tried silicone scar tape. I've been using vitamin E oil. I've tried some different things, but I tried to stick with something for a while. It's still very new for all of my scars, very new. It's gonna take time for them to fade. It's gonna take time for them to settle in and look like what they're gonna look like long term. So again, I'm being patient. And then once I get to the point where I'm like, this is something that really helped me, I will absolutely share that with you. Right now, I'm still experimenting to find what I think is the most helpful thing, and just being patient throughout the process and acknowledging that, like, even if my scars never changed, that's okay. I chose this. I prefer the scars over the loose skin. Do I love them? Is that what I wanted? Scars on my whole body? No, but I chose them, and I'm confident in that decision. How did you handle the emotional side of healing and downtime? I would say the same way that I handled the emotional side of my whole journey, which journaling is a huge part of that. I'm a big journaler. I journal everything that I'm thinking, and that's how I talk myself through things. That's how I talk myself out of being discouraged or being hard on myself. So journaling is a big part of that. I would also say preparing mentally as far as surgery goes. Prepare yourself mentally as much as you can. And you're not going to be able to prepare yourself for everything. There are going to be some things that surprise you that you didn't expect, that you couldn't research beforehand, and that's okay. And prepare yourself for that there are going to be unexpected things along the way. But as much as possible, be prepared mentally for what's to come. And again, I'm gonna bring it back to patience. Like, you have to be ready to have as much patience as possible throughout this journey. It takes time to see the final results, to feel the final results, and you just have to stay consistent with your healing and with what you're doing to heal and recover, and trust the process. If you are not a journaler and you're wondering, like, how do I get started journaling? I do have some journal prompts available. I have a freebie with 5 journal prompts to get you started that I think would be so helpful to get you started on your journey. And then I also have a long list of journal prompts in my guide that I created called Getting Started that helps you while you're getting started on your health journey. I truly believe that journaling has been a pivotal part of this journey for me and part of this process. And if you don't know where to start, just start writing down, and you can check out my freebie if you're feeling overwhelmed at the best place to go from here. Do you still have areas of loose skin left to address? I do have areas that I still want to have the loose skin removed. I also want to be mindful that I'm probably gonna have areas of loose skin somewhere on my body for the rest of my life. And I'm not trying to get a perfect body. That's not what I want. I do want a body that has as little loose skin as possible, because that's just what I want to experience. I want to experience the body that I would have had if I hadn't spent so long mistreating my body. previously. So I have had 3 loose skin removal surgeries. I haven't had any loose skin removal on my legs, and I do have that surgery scheduled for next year. I'm gonna be getting the loose skin removed on my full legs. That's the only other thing that is planned as of right now. There are other areas that I would want surgery on. I don't know if they're going to happen. I haven't done anything to my upper stomach or my upper back. Ideally, I would like to address both of those areas. I have enough to where I can hold it and move it around. And then I do also want loose skin removal on my neck and chin. And everyone tells me that I don't need it. And people even think that I already did something to address it. But it's something that I look in the mirror and I would love to see what my face and neck would look like without this loose skin. So will I ever get surgery for that? I don't know. It's not a priority to me right now. The legs are a priority, and that's what I have scheduled, and then we'll see where I can go from there. How do you feel about your body now after all of these surgeries? I feel very grateful for my body. I feel grateful that it has been able to keep up with me through these surgeries that I decided to do. I have put my body through a lot. I spent a long time not treating it well, eating foods that were really not beneficial for me, not moving it, not exercising it, not loving it, not investing in it. And then now I've been putting it through these surgeries, and the goal of the surgeries is to feel more at home, more comfortable in my body, more free, more able to live the life that I want to live. But I have put my body through a lot, and I'm very grateful that it has continued to do what I've wanted it to do. And maybe it hasn't been exactly as I imagined or hoped going through surgeries and realizing, oh, it's gonna take some time for me to gain my strength back, or it's gonna take some time for me to not feel sore after I'm standing for a while. There are different things that I'm dealing with now because of my surgeries that I wasn't dealing with before, but I also don't have as extreme of lipedema, and I don't have as extreme of loose skin. And that's what I wanted. I wanted to experience a life without those things. And so again, I am just being patient through the process. So the way that I feel about my body is I just truly feel grateful and thankful for it. Some days I feel like I love everything about it. Some days I feel like I don't. But every day I'm like trying not to cry. I should just cry. I'm always crying. Every day I feel really grateful for it. So yeah. Thank you so much for taking the time to watch this video to learn about my journey. I'm so happy to have you here, and I truly hope that it can be helpful to you. Like that's why I'm doing this. This isn't for me, this is for you. I hope that it's helpful. If you have a question that I didn't answer, you can feel free to drop that in the comments, and then hopefully I can answer that for you. There is a chance that I have already answered one of your questions in a previous video, so you can make sure to check those out as well. And then I will see you next time for the next video.